Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone, and welcome to the broadcast today. The director of the Minority Men's Health Center at the Cleveland Clinic, Dr. Charles Modlin, is here to talk about his work and about the mission of the center. Then we will hear from the executive director of Women's Alliance for Recovery Services, Sylvia Pacifico. She's talking about her agency's annual fundraiser. And later in the broadcast, Joan Southgate will talk about the efforts to restore the Cozad Bates House in the University Circle area. Good morning again. I'm Leon Bibb. This is Kaleidoscope, and so we begin. Beginning with Dr. Charles Modlin, director of the Minority Men's Health Center at Cleveland Clinic. Good to have you here, Doc.
Thanks for having me.
How are things going for you?
Oh, excellent. Couldn't be better.
Yeah. What does the Minority Men's Health Center at the Cleveland Clinic do?
The Minority Men's Health Center is created, it's a specialized center for minority men, specifically around the healthcare needs that are unique to minority men. One of our initial target audiences is African American men because of the dire healthcare disparity situation that we see ourselves in.
Is that why you founded this organization?
Exactly. There are several examples of healthcare disparities, and by healthcare disparities I'm referring to a situation where minority men, African American men in particular, have not benefited equally from advances in medical technology, and that's borne out by evidence that African American men at birth have on average a 7-year shorter life expectancy compared to their Caucasian counterparts.
Now, is this biological or is this more cultural? What's going on? Why is it that there is this wide disparity?
Well, there are a variety of reasons that account for the healthcare disparity situation. One is a lack of access to quality health care. Individuals that don't have health insurance have a difficult time getting adequate health care. There are cultural differences that play into the genesis of healthcare disparities. In the situation where when the healthcare provider and the patient are from different cultural or ethnic backgrounds, there may be poor communication, which leads to lack of understanding to healthcare recommendations. The impact of understanding or health literacy, understanding the important roles of health prevention, how they impact your overall state of health, and biologic predisposition, genetic causes account for different disease patterns and disease incidents.
You've written a great deal about this. In fact, I've got one of the articles here that talks about some of the things that you're talking about in this regard. How can we make a dent in this, and what is the Minority Men's Health Center doing to make a dent in these disparities and get certainly a minority men in healthier conditions?
One of the things is to first of all, recognize that the healthcare disparity crisis exists. There was a study by the Kaiser Family Foundation which recognized that about 70% of physicians are not even aware of the fact that we have these healthcare disparities. The first thing is recognition, but we can play a significant role as healthcare providers in eliminating healthcare disparities by getting out into the community and educating the community about these healthcare disparities, the importance of healthcare prevention, screening for cancers, being aware of what your blood pressure is, knowing your family history, things that your family history predisposes you as an individual to certain diseases, hypertension, diabetes, kidney disease, heart disease.
What do you want people to do now? I mean, what do you want men to do? Can they call your office? Can they get involved with you? What happens if they call your office?
Exactly. We're breaking down, first of all, we understand the reasons for the healthcare disparities, and we're breaking down each of the barriers that account for the healthcare disparities. Lack of access. In the center, we actually allow men to come in, access the center, irrespective of their ability to pay. And that's important. That's one important first step. We educate the community, the men, about these important healthcare issues. I want the men to come call 444-5600. We have a weekly clinic every Wednesday where we access patients, evaluate patients, treat patients, because we have to be very active and vigilant about taking care of the community.
Yeah, I want to give that telephone number again. We've got it on the screen, 216-444-5600, 444-5600, or you can go to Cleveland Clinic, clevelandclinic.org/urology, as you see that at the bottom of the screen, cms.clevelandclinic.org/urology. and you can find more information, or 444-5600. You brought a photograph I want to get on the air before we get along too far. Now, I'm going to let you set this up. Who is this we're going to see in just a second?
Okay, we're going to see a picture of an 81-year-old gentleman. He happens to be my father, Charles Modlin, Sr. I have a son, Charles Modlin III, also, but you know, the reason I brought this photograph, he's my inspiration. My father is the current world record holder in 4 track and field events in the National Senior Olympics for men over the age of 80. And he's an inspiration to me. He gives me my motivation and inspiration to go above and beyond to be a servant to the community. He's always taught me the importance of being a servant. You know, I was put in this position as a physician to serve the community, and recognizing, you know, where I came from. It's my role and responsibility to step out and help the minority community, and that's what I'm determined to do.
And your dad's 81 years old.
81 years old.
And I saw you had the medals around his neck. He stays active. He's out there obviously running and walking and doing all the things he needs to do.
Exactly.
So there's no need for the body to wear out.
Well, you know, his major...
at that age.
Oh, exactly. His major message is that senior citizens, everybody needs to stay active and keep moving. He doesn't say everybody has to run, but I mean, that's another important message pertaining to healthcare disparities. You know, it's important to educate ourselves about proper diet and nutrition, but also staying physically active. That's going to play a major role in eliminating and reducing these healthcare disparities, diabetes and hypertension, just to name a few.
And in the last 30 seconds we have, you once again, your organization, you meet on Wednesdays.
We meet every Wednesday from about 9 o'clock in the morning until 1 p.m. The Minority Men's Health Center. It's a center of facilitated patient access. Give us a call, 444-5600. We'll get you into the center. We're here to take care of you. We're available to assist you.
Information, all that kind of thing is right there.
Exactly. Information, education. We'll come out to speak to your organizations also.
Dr. Charles Modlin Jr., medical doctor, director of the Minority Men's Health Center from Cleveland Clinic. Good to have you with us.
Thank you very much. Appreciate it.
And tell your dad, keep on keeping on.
Okay, I will.
And you've got the genes too. I can see it in your eyes.
Thank you.
You've inherited those genes. You keep on keeping on too. Okay.